Now let's talk a little bit too. I wanted to bring some more micronutrients up. So let's look at vitamin B12. So shifting a little bit away from the minerals from that review study and specifically focusing on vitamin B12. The neuropsychiatric manifestations of vitamin B12 deficiency, what you see here in the abstract. Vitamin B12 deficiency can have distressing neuropsychiatric symptoms. It can have an etiological role in clinical presentations like depression, here's what we're after, anxiety, psychosis, dementia. So any of those of you, what do we see in women a lot? I'm not trying to pick on women, but I see this clinically in women a lot more than I do in men. So I'm just sharing my experience with you. But women have a higher level of anxiety, and they also have a higher level of reported brain fog and brain fatigue, right? And this, again, going back to what we were talking about, iron loss through the menstrual cycle, but also B12 loss as well through that blood loss. So we've got B12 deficiency can manifest as anxiety. Now, I've seen this happen so many times where we have someone who's come to me and they've been to psychiatrists, they've been to their family doctor, they've been to a number of doctors, and they've been basically rubber stamped with an anxiety diagnosis. And, they've been put on drugs to treat the anxiety. And that's, maybe that's helpful in some ways, but how many of you have ever had the diagnosis of anxiety and your doctor gave you a drug but did not proceed to share this information with you? So let's look at, formally, these are the symptoms of iron deficiency, B12, and anxiety. You can see the check marks here. So anxiety checks off all the boxes, but look at B12 deficiency, right? Shortness of breath, extreme fatigue, hair loss, depression. Then we have iron deficiency, same kinds of things, shortness of breath, extreme fatigue, hair loss, irritability, the same kinds of symptoms that we might see manifest or progress in people that struggle with anxiety. So my question to you is, if you've been diagnosed with anxiety, do you really have this inherent genetic problem where you're just anxious? Because there are some people, we call them type A's, type A personality, that have a tendency to be more anxious. Are you that? Or do you actually have a micronutrient deficiency that's driving the anxiety forward, that's exacerbating it, or making a pre-existing genetic predisposition much more prolific in your life? And so what I would encourage you to do is, if you've ever had this diagnosis, ask your doctor, it's a very simple blood test, to do an iron panel. Ask your doctor to check your vitamin B12 levels, as well as these other nutrients that we've talked about today. Now, let's dive into some more nutrition-anxiety relationships. So, over here on this side of the screen, you can see, does magnesium supplementation decrease anxiety in adults? This was published in Evidence-Based Medicine. You can see magnesium supplementation may reduce anxiety in adults with chronic, mild to moderate anxiety. You can see here magnesium supplementation may also reduce anxiety in adults with chronic severe anxiety. Then we have this study down here on magnesium as well. Magnesium deficiency induces anxiety, so the deficiency induces the anxiety. Preclinical and some clinical studies suggest a relationship between perturbation in magnesium homeostasis and pathological anxiety. In other words, if you have low magnesium status, there's a greater risk of the developing of anxiety. Although the underlying mechanism remains largely unknown, since there is evidence that magnesium modulates the HPA, the hypothalamic pituitary adrenal axis. In other words, these researchers are testing the theory of whether or not magnesium's role in the HPA axis, that's your adrenals and your pituitary axis. What they found, overall, the present findings demonstrate the robustness and validity of the magnesium deficiency model, and this was done in mice, as a mouse model of enhanced anxiety, showing sensitivity to treatment with anxiolytics and antidepressants. It is further suggested that dysregulations in the HPA axis may contribute to the hyperemotionality in response to dietary-induced hypomagnesemia. So in these studies, they're inducing low magnesium levels to measure whether or not the HPA axis was dysregulated, and what they found that yes, it was. In essence, magnesium, because of its role in regulating your hormones, can play a role when deficient in contributing to and driving anxiety up. Now, what else do we know about magnesium? It's Mother Nature's muscle relaxer. Now, a lot of doctors prescribe different types of drugs, including muscle relaxers, for people who have high levels of anxiety. Anxiety, for a lot of people, a lot of times will manifest in the muscles as tightness. Again, going back to what I said earlier, those catecholamines like adrenaline and noradrenaline will make your muscles really tight, really stiff. That can cause a lot of tension. And what does magnesium help to do? It helps to relax the muscles. So what kind of quantities are we talking about for magnesium in this way? Well, some studies show that as little as 200 milligrams of magnesium can be helpful. So, if we're looking at safe ranges that anyone can use, it's 200 to 600 milligrams per day, divided doses of magnesium as a very safe range to stay in. Generally, if you're going to go too much over 600, it might not be a bad idea to work with a doctor or get your levels checked. But magnesium can definitely play a role, and there's definitely association with magnesium deficiency and anxiety. What about vitamin B1 thiamine? So you could see this was a study done on the impact of thiamine treatment for generalized anxiety disorder. Though it was a small study, there weren't a lot of participants in this study, the results were still quite profound. Thiamine supplementation significantly improved HARS scores. That's the Hamilton Anxiety Rating Scale. So this is, again, a particular way we measure anxiety. Increased both appetite and general well-being and reduced fatigue in patients with generalized anxiety disorder. Now, this last statement I find more than interesting. I find it quite appalling, and that is, interestingly, these patients were able to discontinue taking anxiolytic and beta blocker medications. Now think about that for a second. How powerful is that? You have patients that have a generalized anxiety disorder diagnosis. They're being medicated for it. They put them on vitamin B1, and now they're able to get off their medications and still feel better. So again, is anxiety a true disorder, or is anxiety a nutritional problem? My advice to you is, if you don't know why you were diagnosed, you better get your nutrition checked. There's so much evidence that nutrition plays a role in this, and if you're not looking at it, you could be missing something very key and important in your longevity and your health. Now let's look too at some other B vitamins. So this was published, this was a review study published. You can see the role of vitamins and minerals in psychiatry. And so you can see here, look at the introduction. I love this first statement. Roughly 90 years of research demonstrate the relevance of dietary nutrients for mental health. 90 years. This is not new information that I'm presenting to you. 90 years of data. Some of the earliest research studies on nutrients relevant to mental illness observed irritability and mood problems in people known to be deficient in the B vitamins, as well as reported positive improvements in mental illness when treated with such nutrients as manganese. So manganese being a mineral. So going back to, we already talked about zinc and iron. We talked about copper a little bit. We talked about magnesium, etc. And nicotinic acid. So nicotinic acid is also B vitamin. It's actually vitamin B3 or niacin. And so, regardless of whether or not the patients could be found to be deficient, so in other words, treating patients with these nutrients led to improvements even if these patients weren't found to be deficient, meaning there's a therapeutic role for these nutrients to play. Although interest in such studies have declined since the introduction, go figure, right? Since the introduction of psychiatric medications in the 1950s, all of a sudden the interest in nutritional research started to decline. Now, why do you think that is? Do we have a body of evidence that shows there's very tremendous impacts and effects on people's mental health disorders using vitamins and minerals? Very safe, very low risk, no side effects, not expensive. But then in the 1950s, here comes the psychiatric meds. Super dangerous, super profitable, patentable. So what do you think is going to happen to the prior research? It's going to get discouraged, right? Because it's not profitizing. It's not something that's going to make people a lot of money. And so we saw the entire medical profession navigate away from therapies that worked in lieu of therapies that were profitable. Now, say what you want. You can accuse me of being an anti-medical establishment person, but I'm not. I'm a truth person, and I want you to know, because a lot of people don't recognize the importance of the brain and the mouth. What you eat, what nutrients you put in is going to affect how you think, and this could never be more important than it is today. Look at society. We've got school shootings, we've got people road raging, we've got people angry at other people for a variety of different reasons because of differing opinions. And so never have I seen more segregation and hate and anger in the world than I've seen post-COVID. And if we're not going to have a conversation about nutrition and the mind and psychiatry, we need to have this conversation in a bigger way, because the psych meds have had 70 years to change it, and they haven't. Problems are getting worse, not better. We've got to turn back time, and we've got to start looking at these micronutrient connections. So you see here going on. Recent work on folate or vitamin B9 suggests that low levels may be associated with depressive symptomatology and poor response to antidepressant medications. I found that interesting too. In other words, if you were on an antidepressant medication and not responding well, you would respond, and research has shown this, you will respond better if you take folate. So do you need the antidepressant medication, or do you just need more folate? That would be an interesting study for somebody to do. I don't believe that one's been done yet. Going down the list here, thiamine, vitamin B1. For anxiety, thiamine has been used successfully at doses. So here's your takeaway. Doses of 250 milligrams a day to treat patients with anxiety disorders, including symptoms manifesting as chronic fatigue, insomnia, nightmares, anorexia, nausea, and vomiting, diarrhea, or constipation, chest and abdominal pain, depression, aggression, headache, diaphoresis or excessive sweating, and fevers of unknown origin. Among over 200 subjects, successful responders had deficiency or deficient RBC transketolase. You've heard me talk about this before. Transketolase coactivity or co-efficient activities, or TKCA. It's a type of test. It's a rare test. There might be one lab still in the U.S. that will perform transketolase activity coefficient testing. But what they were finding is that those that were good at responding to thiamine dosing, they found low RBC transketolase in 73%, and that when supplemented, those were normalized. In other words, this is just a marker for vitamin B1 deficiency that can be measured. So you could potentially ask your doctor to do it, although they may not have the ability. I like to use what's called intracellular testing to detect vitamin B1 deficiencies. It's also very helpful. But let's go to this last sentence here. So again, let me reread that to you. So among 200 subjects, successful responders had deficient RBC transketolase, which normalized in 73%. So again, it corrected 73% of these people's vitamin B1 deficiencies is based on that particular lab test, and subjects and led to disappearance of great clinical improvement in most of the symptoms. So powerful. Like, this is powerful medicine, folks, that's being dismissed as quackery because it's nutrition. And then we get down here to vitamin B6. And you see B6 and folate have been used successfully for depression. And then we have inositol, is unofficially a B vitamin that is found in cell membranes, where it functions closely with choline. We've got crash courses on both of those. Inositol was equivalent to single drug therapy for depression and panic disorder in one study and is a potential antidepressant. One study found 75% of depressed patients to be magnesium deficient, with another 99% at borderline levels. Magnesium supplementation was helpful. So we've got inositol, we've got vitamin B6, we've got magnesium, we've got choline. And again, inositol was equivalent to single drug therapy. How many of you have ever been to a psychiatrist where they pulled out the prescription pad and said, here you go, I want you to take inositol, instead of putting you on a potentially very dangerous drug with a lot of side effects? A lot of these antipsychotic and a lot of these anti-anxiolytic medications cause B vitamin deficiencies. That's one of the other conundrums, is the very drugs used to treat anxiety can actually deplete your B vitamins, deplete your magnesium.